Hi guys, and welcome back to episode 2 of the Paper Pod.
I'm Tasnim and I'm on the academics team as well as a junior doctor in London.
I'm Maisha, I'm also on the academics team and I am working as a research scientist.
Cool. Okay, and just a brief recap. If this is the first time you're joining us, we are doing a monthly review as part of the Maa Journal Club of papers within maternal healthcare literature. And the aim of the game is to go through, see the lessons that we learn and can incorporate into our own work, as well as improving transparency across the academic world and primarily for the rest of our Maa members across the charity, but also for the wider public.
Yeah, and we hope whatever we discuss will be super interesting for everyone and, like you said, improve the transparency and allow everyone to get involved in, the academic side of things. Yeah, cool.
Yeah, because you've had some exciting stuff happening.
I have. So I have recently been selected as the UN Women UK's delegate, which is really exciting. It's a volunteer role. But I think it'll be a really cool opportunity to get involved and network with other academics in the field that are pioneering for women's health, well, not just health, women's rights, anything women related. And I think that relates nicely to Maa being a maternal health charity. So yeah, that's really cool.
Yeah.
And you've had some exciting updates as well.
Firstly, congratulations.
Thank you.
And yeah, what did I do this month? Completed a set of nights.
Wow. Congrats for getting through that.
And we also had the Maa AGM, which is the annual general meeting where we discussed all our projects, and it's really exciting. It looks like a really great year to be a part of, and more will be revealed at the gala. And what else? I completed my first 100 kilometers of runs throughout January.
Congratulations.
Yeah, thanks.
Inspiring to me and to everyone.
I don't know why I even signed up to this, and my sisters bumped up the kilometers to run every month. But it's essentially to raise funds for Journey Maa trip this summer.
Yeah, I think this is a good opportunity to plug fundraising for both of us. We're both going on the Journey Maa trip this summer, which happens annually. It's a really amazing opportunity for members, not just of this team, but of also the public, to get involved and see what Maa is actually doing in the health camps back home. So we'll share the links to our fundraisers at the end or somewhere. So thank you.
The paper is called Mass Media Exposure, Maternal Healthcare Utilisation in South Asia, which was published in 2020, so in the midst of the beginning of the pandemic. And I did some background on the authors. And Kaniz Fatima is a PhD student in the States, in Iowa, within sociology and criminology. And this is one of the papers she's published within her PhD, which is actually pretty impressive because usually that happens after you've completed your PhD.
Yeah, that's true.
So that was really cool. And she did her bachelor's in Bangladesh and has moved over to do her doctoral thesis in the States.
Oh wow, so, very impressive.
That's pretty cool. And then there's Joseph T. Larissy, who is more on the socio-demographic side. So he has completed his PhD and works within the field, mainly contributing to examine racial and ethnic inequalities in older adults. But as we'll see in this paper, his background comes in really, really useful for some of the statistics that we'll be discussing today.
Amazing. So I'll just give a quick overview of what this paper is about. So as Tasnim said, it's measuring the exposure of mass media in utilisation of maternal health care across South Asia. So they looked at the effect of television, radio, and newspaper as the three main types of mass media on how it might affect the utilization of maternal health care, namely antenatal clinic visits, postnatal clinic visits, and delivery. And essentially, this was looked in 4 different countries. So we have India, Bangladesh, Pakistan, and Nepal. And they did find at the end from doing this review that the mass media was actually very effective, especially amongst women who were least educated or had primary school level education. And the most effective method out of the television, radio, and newspaper seemed to be television. Yeah. So that was quite interesting. Yeah. So that's a brief overview of what happened in the paper.
Yeah. And I think just digging a little bit, it was really interesting to see how they kind of grew this idea from a previous paper by Ghosh in 2006, where they went through a similar kind of tactic of national health surveys and demographic surveys to see how mass media affected things like vaccination programs, maternal health care, but it was a various range of things that they were looking into within the healthcare field. Yeah. Whereas here, Fatima and Larissy have really honed in on maternal health care, which is much more aligned to what we do here at Maa, with, as you said, antenatal delivery and postpartum care. Yeah, exactly. And I do think that they did build off this paper from Ghosh in 2006, where one of his main findings, or one of their main findings, was that this mass media was really effective for people who had a lower education level. Yeah. And I find it really interesting in this paper how they sort of tried to control for that. And they also did a comparison to see whether it was actually a confounding variable. Yeah. So maternal mortality was one of the main factors that was assessed in this paper. And they focused on South Asia because it is one of the highest places where maternal mortality is still a problem, that being after sub-Saharan Africa. Yeah. So it was something that really needs to, be changed, that number needs to be brought down. And accessing the role of mass media is really interesting because lots of people have access to the internet, smartphones, social media even. So I think it was a good idea for this. It was a really revolutionary idea, I'd say, to look into this relationship. Yeah, I think definitely it's a relevant kind of idea to look into. Yeah. However, they didn't look into things like social media. That's so true. Which is a limitation that they state themselves. Yeah. Which is nice. However, to take into account the national demographic surveys didn't account for Facebook or Twitter or social media use, which came into later effect from 2019, I believe, and onwards. So then the next kind of review could incorporate that to have a better overview. Yeah. But I think it was a good start. This is definitely a very relevant start in less economically developed country where television is probably a little bit more relevant than social media, especially in this time frame. They use the national demographic surveys for the information for the exposure to mass media, right? Yeah. And they're also saying that this wasn't covering a lot of things and there was inconsistency in them as well, I think, as a limitation. Okay, yeah. So I do think that, again, the attempt was really good, but you have to take into account that it might not be representative within the nationally. Of course, internationally is different because 100%. It's one particular part of the world. Yeah. And so if you were then to, in the future, want to include social media, you'd obviously have to first overcome the barriers that already exist within the demographic surveys like this for these types of mass media, and then social media, or create something new. I think this is still relevant because in the case of using mobile phones, even though over 90% of the population in Bangladesh, for example, in 2018 had access to one, usually, this may have changed, but usually it was between a husband and wife.
Oh, true.
So it was shared, so then it's very difficult to
tell who's
ascertain.
actually...
Yeah, exactly.
Is it the husband or the wife?
Yeah.
And what if they, with their children, if they had children, they allow the children to use the internet or something, and you don't know who's looking into what, who's watching what. That's true.
So probably this is actually more relevant
in
terms of mass media.
Yeah, for sure.
Which is cool.
Yeah.
Oh, there was one more thing I wanted to add, that in terms of the statistics, the majority of the stats are from India, which I guess the models and the stats took into account to calculate the odds ratios. Yeah. But it's something to keep in mind. Yeah.
Maybe it was to do with the availability of the information.
And population. Population in India
is so much bigger than the other.
Yeah.
Yeah, that's true. That's true. Cool. Yeah, one thing they also emphasized in this paper was that many women in Southeast Asia have a limited formal education. I don't know how much of a sweeping statement that is, because there are women that are educated, of course, and I think it depends on the areas they were looking at, but they did have this debate about rural versus urban living. So I think they did try to address that. Yeah,
and they stated that 70% of the population lived in rural areas in comparison to urban. But one thing I was really surprised at was the stats for education for women within Pakistan.
Yeah, me too. It was like 43% or something that are not educated, which was quite shocking, actually. Yeah. And it's interesting to see such a disparity in countries that are sharing borders and neighbouring each other. Yeah. So it must be some sort of more psychosocial or cultural.
Yeah, they did touch upon that, but I did not expect that at all.
Yeah, me neither. And I'm really interested in like anthropology as well, so I feel like it would be really interesting topic to see why these disparities occur. And even when I was writing my master's thesis, when I was discussing maternal mental health in Bangladesh, it sort of just opened up a can of worms about like the stigma around mental health and stuff. And it even exists in Bangladeshi diaspora, like here in places like Cardiff and stuff, which just goes to show there's probably deep-rooted cultural opinions about certain things like mental health or education or the status of a woman. And that probably brings in a lot of like, knock-on effects. Yeah. So,
I think off topic, but plugged for one of my favorite books ever, The Gene by Siddhartha.
Oh, yeah.
Who is Bangladeshi, from Calcutta, Bengali, and he writes this book on the history of the gene and how he really, really beautifully threads his family history of mental health and the issues that they faced during the time of the partition and how that has affected generations. Which was super interesting. So that also ties into how the diaspora can be affected regardless of location based on something like history.
Exactly. It's a complicated relationship, I think, but it is equally as interesting to look into. Yeah. I think the first shocking stat was this one at the front. The 94% of all maternal deaths occur in developing countries. Which is huge. Like 94% of 7 billion, almost 8 billion people on this planet is a lot. And you'd think we'd have done something by now to have a less distorted, figure. Or,
I think it's, in terms of Bangladesh, I would say it's been impressive. From 2000, the maternal mortality rate was 434 per 100,000 live births, which then in 2019 dropped to 156 per 100,000. and then the whole WHO, so the World Health Organization, coming up with Sustainable Developmental Goals, so SDG 3. 3.1 is for maternal health, and that was one of the driving factors that really helped drive down the numbers for the maternal mortality rate in Bangladesh. Mostly within 2000 and 2010, and then those stats started to drop off in terms of they became more stagnant, which is why, as we are now in 2024, the aim is that by 2030 that we have under 70 deaths for maternal mortality per 100,000 live births. And to think right now, if Bangladesh is at 156, to basically halve that in 6 years it's a lot. It's a lot. It's a lot to ask for. But a challenge, I think we should. That's the point of having goals like this, that you drive towards a specific target as close as you can get, or even further. And if we've already dropped it by half, why not?
Exactly. We're on our way there. And it's definitely possible because it's been done so far. And I also forgot to mention earlier that tomorrow is the International Day for Women and Girls in Science, which links nicely to, you were talking about Sustainable Development Goals just now. And SDG 5, I think, is to achieve gender equality and empower all women and girls. Which I think, obviously, it's been important for ages. It's still important. And linking on to what we were just saying about the educational status of women, and how we were shocked by the statistics in Pakistan, I think it's just an opportunity to remember that gender equality has not been reached in a lot of places. The gender pay gap still exists here. And then, of course, in the developing world, sometimes because of the patriarchal nature of a lot of the communities, this struggle is still seen. So
I think one thing to note here, one of my really good friends sent an excerpt from a book with daughters from less advantaged backgrounds reaching positions of power. They really tie into the fact how fathers helped escalate that and helped empower the girls to reach levels of higher education, and then in their professional lives to then take on certain roles. So I think it's nice to see that those aspects are already in place, and we are able to recognize that, and how empowerment of women involves really everyone. So some positive recognition.
Definitely.
Of our fathers.
Men have such an important role in
100%.
Just in life in general, especially in communities again that are quite patriarchal. So
Nepal does really well in terms of antenatal care.
It does, it does.
And I wonder why, because they didn't really delve into that.
I also found it interesting how they differ in the types of mass media that they consume. There was stats there, whereas Nepal is huge on radio, which is it's not shocking, but I would have thought it would have been similar, especially with the TV becoming quite popular. I wonder why. Food for thought.
So one of the main driving forces of investigating mass media in terms of television, radio, newspapers is because of how far-reaching it is, as well as from previous work we can see how it has reached rural populations and the least educated parts of the population. So to be able to do that is really powerful in itself. And then to drive out what the positive factors of mass media are, is also quite nice to see here, because we tend to see from social media more of the more often the negative outcomes of it. So yeah, they tie into the fact that low cost is an aspect, so it's kind of sustainable, and it has helped in the past with family planning and with health promotion, preventing disease, with vaccination programs. The polio vaccination program in Pakistan was eradicated recently, where it was very useful. Also, so there are three main terms that they go into. One being the cost, the second being the educational part. So you can announce the time, location, dates of programs that mothers, or for example, this is on maternal healthcare, that mothers can attend to have free healthcare checkups. And I think that's also something we can take on board with Maa, with some of our projects. And we were thinking of how to promote some of our projects for the wider public in rural areas. So TV may actually be an option we look into. And number three is really sweet. It's about unity and bringing people together with forms of art. And how there's this, we call it a nato in Bangladesh, right? Which is essentially a series of Ujan Ganjar Naya.
It should bring up, you probably didn't butcher that pronunciation.
Joshua Bangla, which translates to Sailing Against the Tide. And it was broadcast in 2014 on early marriage and pregnancy, which is such an interesting way of promoting.
100%, because it really targets that whole cultural interest in watching these sort of telenovelas series almost. And the target audience is there, you know, whether it be the women or the husbands or the men in the family, mother-in-laws who have a big impact on what women do. And apparently it was quite revolutionary in, you know, helping with health promotion. So it's a brilliant example. And it's also set in a rural village, so it's relatable to the audience, which is wonderful, I think.
Love that.
Nice.
And then they really nicely lead into hypothesis one, which is how mothers exposed to mass media are more likely to seek maternal health care at the three stages that we discussed.
Essentially, they did find that less educated mothers benefited more from the mass media coverage than educated mothers, but there was some discrepancy in the country. So namely in Bangladesh, the middle-aged mothers were more likely to use maternal healthcare services after being exposed to this mass media, comparatively to most of the other countries, and some that weren't tested, for example, Ghana. There was the younger generation of mothers that were more likely to actually go out and seek help, which I thought was interesting.
I think, I mean, it's from a previous study, and I don't know how they really investigated that. But I think they suggested that it was in terms of schooling and education, where younger women in Ghana who are more likely to go through high levels of education would have more of a background of when and why they should seek maternal health care when pregnant or thinking to have a baby.
Which is how they came to their second hypothesis anyway, which was to account for sociodemographics as confounding factors, namely educational attainment as being a moderator.
Larissy comes into play here with his socio-demographic kind of background, and they find that actually women who have high levels of education are less influenced, or it doesn't really change their mindset so much because they have the autonomy and the background from their education of when they should seek medical attention with regards to maternal health. Whereas with women who have primary school education or even less so, seem to benefit more, because then they learn, okay, these are the red flags that we need to look out for, and then seek healthcare. And they also really nicely incorporate the concept of the 3 delay model, because even if a woman in a rural village sees this on TV, they're watching the drama and they think, oh, something similar is happening to me, maybe I need to see a professional. The availability of healthcare facilities in a rural setting is much rarer than in an urban setting, where you have more hospitals, you have more clinics, you have more access to healthcare. So that was quite an interesting factor to look into.
I think they mentioned that for sure, because they were saying rural versus urban was definitely a factor they had to consider when thinking about access to healthcare, which makes it a 3 delay model, because you've got like a physical barrier to actually reach healthcare facilities. But yeah, for sure.
And also, I like how they incorporated the husband's status in terms of education and socioeconomic background.
They were saying if the husband is more educated, they're more likely to actually push for the wives to get good healthcare, whereas if they weren't, they were probably more scared of women going to health facilities and having to interact with other men.
Exactly. So then that begs to question, like, the question is, in Pakistan, what is the education status for men? And is that tied in with the 43% of women being educated? Is that tying into it? Because initially I thought, it's more likely that a man is sent to be educated, and the women maybe married off earlier, or for cultural reasons not sent for higher education. But maybe some of the figures here actually shocked me in terms of odds ratio. So an odds ratio is the likelihood of event A happening over event B. And as you can see, the husband's education in model both 2 and 3, the numbers increase. So for no education, 1.0, all the way down to higher education, 1.449 in model 2. Which showcases that, yes, the more educated you are, the more likely you are to advocate, on average, that your wife seeks medical attention. However,
sorry, no, go. I was just going to say, it's also worth noting that they were extremely statistically significant results to p-value 0.001. So
that was insane.
As close as you can get to shore in scientific evidence.
True. But then there was also something about husbands going out to work being more prevalent than them going into higher education in rural settings. Which is very interesting.
I think that might have something to do with the environment that they're in. You know, like to earn money more, it's probably quicker than going out to study and then looking for a job. And if they're not planning to leave, maybe if they're in a village setting, they're not planning to leave and shift somewhere, whether they could be working in an office or like some sort of administrative role even, then it might seem like to them that they don't have a point. There's no point, in doing education. And
I remember that kind of situation where when I was last in Bangladesh, we went on a boat trip in Jaflong at the border, one of the borders with India. And the boy there was a young man who was driving the boat, but then there was also a boy on the end of the boat, like controlling something. I don't know quite what the mechanics are. But he can't have been more than 10 years old maximum. And the kids in rural areas are smaller, so he may even have been
maybe like 13, 14,
maybe. But he should. someone who definitely should be at school.
Yeah.
And this was on a weekday.
Okay.
In the middle of the day, and he's on a boat.
Driving.
Yeah.
Helping it drive. Yeah.
Why?
Yeah, that's the other thing. It's like the strictness of the schooling system.
Yeah.
And I think that's got better recently in Bangladesh.
Do you think?
I feel like I've read this somewhere.
Okay.
But again, if you're not managing to reach rural areas or every small village community or slum, then how can you guarantee that these kids are going to school? And if the parents see the child as a financial liability, I remember when I was studying my master's, we did some modules about this, and we were looking at African countries. But I feel like it's applicable to similar communities in the East, where especially girls, if not boys, they were looked at as a financial liability on the family until they could be married off. So they didn't really feel like the need in investing in their education. And then it also was pressure for them to get married as soon as possible.
Okay.
And if they didn't, the parents were needing to spend more on them than they should have.
Yeah.
Because it should become their husband's responsibility. And equally, it also brought into an argument about if they got married and went into a new family, these daughters, if they were facing some sort of disagreement, abuse, they couldn't come back home.
Okay.
So, of course, that's specifically towards girls, but I think for boys as well, I just think you can apply the same idea if children are seen as a financial liability. And if they're old enough to work, well, then they can be labour, if that makes sense.
Yeah, for sure.
Invest, help to earn for the family is what I mean. So yeah, but it's definitely something no one's sure, right? We wouldn't know. We're just hypothesizing here. How can you improve the schooling system? How can you make sure kids have an education to a certain age at least? Yeah.
Is that in the scope of maternal health care? We need someone who actually specialises in this to take this on. This
again, it's one of those things.
It's a huge topic.
It's a huge topic, and it's like one of those things that has knock-on effects, right? Like,
on maternal health,
exactly.
It does. For sure.
Yeah. So when looking at the results of the paper in more detail, as mentioned earlier, we came across TV being the most common form of mass media in each country, although Nepal has a large amount of radio listeners, which again is interesting. I wonder why, I wonder how, which parts of the population were tested, we don't know. A newspaper was the second most popular, again, apart from in Nepal. Antenatal clinic usage was least common in Bangladesh at a very low percentage of 21.5.
But, sorry to interrupt.
No, go for it.
The latest figures suggest that this has increased to around, there's a range, but ranging from 24 to almost 50 in some areas.
That's great. Again, that's a brilliant increase. And I think it's WHO recommends having 4 antenatal care visits.
It's updated.
It's updated to 6 or something. No?
Updated to 8.
It's at 8 now. Okay, because in this paper, the suggestion from 2019 said it was 4.
Yeah, this was 4.
Yeah.
And then at some point, I do believe it was 6.
Yeah.
But 2024, it's now 8.
Okay.
Which is, I think they're bumping it up to help speed up the process of reaching the goal of under 70 per 100,000 for maternal mortality.
Yeah.
But 69% of women internationally do have links to antenatal care within their pregnancy.
Is that worldwide?
That's what a worldwide statistic. Yeah. So it's
variable. Yeah. That's still a pretty good number.
Yeah.
But I guess then basing it on the fact that the recommendation from the WHO is now 8 visits, if Bangladesh at this time was at 20% for 4 visits, you can only imagine how much more needs to be done, right?
Yeah.
So, yeah. Okay, and as we mentioned earlier, we were shocked to see that in Pakistan, almost half of the women have no formal education, which was one of the important confounders that they were testing in this paper. And 70% of women live in rural areas. And in terms of reach and access, the urban areas tend to have more health facilities and easier reach. So that probably added to the setbacks, for sure.
Yeah, and I think in terms of when they go into the wealth status, it's split into quintiles. I think it will be difficult to assess wealth of a family in Southeast Asia because you have generational households with several different types and sources of income, both nationally and from international relatives, because there are a lot of people who move abroad from Bangladesh, especially from the villages. So I think that's something to take into account with a pinch of salt. I think the disparity is quite hard to stomach, that the wealthiest of households have a 5 times more access to health. So they're 5 times more likely to seek medical attention within maternal health.
That's that's one of the things they found in this paper, just to clarify that. The wealthier were 5 times more likely. That's crazy. How how does that affect things? Again, it goes into this really deep-rooted debate about what initial factors have on this massive knock-on effect for health-seeking behavior and just even social behavior, I think.
What do you mean?
As in ability to exercise, want to exercise, access to gyms, access to food, types of food they eat, smoking status even. Maybe even in the past in the UK, like smoking used to define being of a high status, right? It was cool until obviously the whole lung cancer thing came out in the 50s. And even in some countries now, being overweight or big shows that you're wealthy or more desirable for women, when in fact it's not good for their long-term health to be in an overweight or obese side of the spectrum. So I'm just thinking that those kind of like social behaviors and access to things like good food, health, a gym or green spaces to walk and stuff like that, whether that's also linked with wealth. Because it's easy to say, oh, the wealthier have better health-seeking behavior, but why? Obviously the money helps, especially in places where you haven't got free healthcare, and if private healthcare is quicker, it's more reliable. If you have the money, it'll be easier, for sure. But I do think, putting even education aside, the wealthy might have access to these things, or have a different view on stuff like smoking, drinking.
True. That's true.
Yeah. I just think it's an interesting debate. Again, it goes down this whole anthropology thing. But this is where all of the sort of social sciences really overlap. When trying to find a holistic approach to improving such a big thing.
That's so interesting, because that's not the kind of route I am from. I don't know much about that side.
Exactly. Whereas I've sort of dedicated more of my educational background and work right now on social determinants of health and linking actual health outcomes to not like biological or medical pathways, but more so behavioral things. And I think it's a really up and coming field, and it's super important to look into.
For sure, because I think for a long time it's been seen as the softer side of science, but really over a long term period, even in medicine, our first line of management is always lifestyle.
Yeah, exactly. And there's social prescribers now as well.
Yeah.
So yeah, for sure. But yeah, it's a super interesting debate.
Yeah, I think one qualm I had was with the ranges in the percentages within the results for antenatal delivery and postpartum care.
Oh, me too.
Yeah, because
it ranged from like 20 to 60.
Yeah, so where is it? Or I think it could have been split per country, because that's what I'm guessing the stats are from.
So it probably would have been a bit more useful to have a specific percentage and then confidence intervals or something. Or maybe that's what they were trying to say. I'm not even sure. But yeah, they even had those numbers in the abstract.
Yeah.
The varying percentages.
Yeah.
It would also be interesting to actually know which communities they tested in these countries. Because these countries, Bangladesh, I think, is the smallest of all of them.
Yeah.
Then Nepal, then Pakistan, and then India. But like which community? Like you're saying rural versus urban.
Yeah.
But there's like a bunch of urban centres and there are many rural areas. Like maybe, how do we know? Like whether it's representative is one thing. And also if, for example, if you went to one, like taking Bangladesh as an example.
Yeah.
If you went to like a rural village in the south, the conditions are completely different to the rural villages in maybe Sylhet, which is in the north.
True. Yeah. But how realistic is it to do that from a national demographic survey?
That's true. I mean, they're taking it. That again comes back to the question of how representative and consistent is the national demographic survey.
True. Yeah.
Because like in the UK, we have the census that comes around every 10 years. Right?
Yeah.
And it's like you have to fill it in something. So how complete is the information?
True.
But I do think if they were more clear about, okay, this is the area we tested, and this many people had definitely filled out the demographic survey, then they maybe would have had less discrepancy in their percentages.
Fine.
I can understand why they tried to make it more applicable.
Yeah.
Because it sounds like such a small group size if you really make it narrow. But at the end of the day, if you're doing a scientific experiment or analysis, you need to be...
True.
Yeah.
Okay, I see where you're coming from. But I think they try to touch upon that fact with... or that limitation by stating that 70% of the population live in rural areas.
That's true.
Plus the wider aspect of places, let's say, for example, India. We know that the north is less advantaged than the south. So just having like a brief overview of how it may look across each country, I guess, is useful in itself, with rural populations always being... most likely being the less advantaged in maternal health or in healthcare in general. I think it would be very nice. But then how does that help us at Maa? Like how would that help us do something differently at Maa?
As in,
if we knew those specifics.
I guess because we're also starting small, right? We're in specific villages in Bangladesh. I guess knowing, for example, if they told us which areas of Bangladesh they were in, we might be able to use the information to adjust or adapt our clinics to it. You know, like the example I just gave of like being in the south of Bangladesh and the north of Bangladesh, so completely, even climate. It was slightly, because like you've got Cox's Bazar, which is like on a sea, border with the sea, right? And the north is landlocked essentially. So, and there's more hills and stuff. And the prevalence of like even mosquitoes is going to be much more in the south because of the stagnant water compared to the north. Obviously, I'm not sure on the stats on that, but just based on the conditions, we can then target like what the maternal health like needs might be.
Fine.
You know, based on the area.
I think.
Just a suggestion. What do you think?
I think that's definitely something to explore. But what I'm thinking right now, like off the bat, is that sounds more geographical. So probably someone more on that aspect of studies, and maybe literature from that side that we need to look into. But right now, in terms of Bangladesh, Cox's Bazar is actually where maternal mortality rate is the worst. But we're based in Mullah Bazar because we want to build up a model that we can definitely say we've made a difference and be able to control certain factors in comparison to in Cox's Bazar, where you have a huge amount of governmental, non-governmental organisations, which we discussed last month. So it's more difficult to do that. But once you have something in a controlled environment set up, then you can copy and paste that into different places, right? And then I guess you have the overall view of Bangladesh. For example, Chittagong is very international. It's where the most educated people of the country are. And I guess the statistics then would most likely show that it's more favourable for, let's say, maternal health. And yeah, I guess the finer details is useful for us to kind of bank in on for the longevity of the charity. But starting off, I guess this is a really good starting point to go off of.
No, 100%. Whatever they found, and the fact that the mass media exposure is useful for disseminating healthcare information and promotion of healthcare, that's useful in itself, right? And then the more nitpicky side and the details obviously will be useful, like you're saying, in the future for expansion of the work we do. Yeah, for sure.
And I also really like how they acknowledge that more research needs to be done for sub-Saharan Africa, where maternal mortality
is even higher.
Exactly.
It's the worst, for sure. And they take into account the fact that you can't generalize this information from Southeast Asia to Africa, even though people look at it as the global South and the global North.
True.
The whole of the global South has completely different cultural settings, communities, climates, health burdens, disease burdens. So yeah, I'm glad they also stated that.
I think that's it, right?
So
anything key you want to round off with that you've enjoyed from this paper?
I just think I think it brings really good potential uses for mass media in the future. Definitely with Maa's work, how we can spread the word about what we do. I think that's a key finding. And knowing that TV is like one of the best ways forward is good, because I'm also thinking they tested newspapers, but if you don't have a good level of education, how good is your reading? So TV for sure. What about you? What have you taken from this paper?
The positive side of mass media. It's been nice to read about that, and also some of the disparities within Southeast Asia that I wasn't aware of has been really useful. I guess in terms of general knowledge. With things like the GDP in Bangladesh being around 450 billion versus like 350-ish billion in Pakistan. So they're not far off from each other in terms of GDP, but how the educational status is
still differs massively.
Still so different. I thought that was one of the most interesting concepts I learned. And the TV series. I really enjoyed that.
I didn't know about that TV show. I think that's really cool that it's made such an impact. And it's nice to know that people are already thinking to make stuff like this and reach the audience that they need. So that was really cool.
Nice.
Well, thank you guys for tuning in, and see you next month.
See you. Thank you.